Nearly 5,000 dead, Ebola continues to ravage West Africa with no sign of slowing down. Now people have become infected outside the continent, including in Spain and the United States. Earlier I sat down with Dr. Julie Fischer, an associate research professor in the Milken Institute School of Public Health, to discuss measures being taken to battle the disease. All right, Dr. Fischer, so let's start with the very big question that's on everyone's mind. We've seen mass hysteria in the media. What is the true risk of a widespread outbreak of Ebola here in the United States?
So despite the events of this week, we still feel that the risk of a widespread Ebola outbreak is extremely low. In the U.S., we do have good health care. We have good infection prevention and control measures. We can't rule out that there will be more individual cases and even small clusters as travelers and potentially healthcare workers come into contact with people who are infected. But in the U.S., the risk of coming into contact with a person with Ebola virus disease is still extremely low.
And you mentioned the events of the past week. We've now seen at least 2 cases at that Texas hospital where people have become infected with the virus. And there are questions now about how prepared that hospital was, whether or not they have the appropriate gear and the nurses have the appropriate training. The CDC director said that originally the hospitals are prepared, but are they really here in the United States?
I think that what we're seeing now is the gap between the ability to review protocols and look on paper at practices, and then the ability to really carry them out in a way that leaves health workers both confident and feeling that they have really mastered all of the skills that are involved in infection prevention and control for Ebola virus disease. As the CDC director mentioned, CDC put out guidance months ago on healthcare worker protections, particularly how personal protective equipment should be used to help prevent the spread of Ebola from a patient to a healthcare worker or to others in the hospital or in the community.
But those seem to be rather complicated, and then you have nurses' organizations saying that they didn't feel like they were appropriately trained.
Right, and I think that training is really the key. So that information was disseminated, and CDC made it widely available, but having that guidance in hand in the form of diagrams and posters is certainly not the same as having practiced over and over. And what we do know is that Doctors Without Borders, Médecins Sans Frontières, which is the group that has done the most training of healthcare workers and the most direct hands-on treatment of patients in West Africa with pretty good success at protecting their healthcare workers, train their workers for a minimum of 2 weeks, including days and days of hands-on, closely supervised training. And they use buddy systems to help make sure that everyone is following all the directions from beginning to end. And I think what we're learning in the US is that we have tremendous ability to send out information electronically, but that's not the same as making sure people have been
in-person follow-through.
Exactly.
And so, in addition to those training, are there any other steps the United States need to take, the CDC needs to take, in order to increase our own preparedness at these hospitals?
So there's a finite amount that the CDC can do, and I think one of the things that's important to talk about that's getting a little lost here is that CDC is our reservoir of technical expertise, but they are not staffed in any way to put people on the ground in each and every hospital in America, or even each and every state in the US to supervise in real-time preparation. So what CDC needs to do now is really make sure those state and local health departments, who will ultimately be responsible for making sure that institutions in their states and their communities are prepared, have the information that they need, and that we start training as many people as we can using the lessons learned from the hospitals in Georgia and in Nebraska that have had experience in caring for Ebola patients.
So that then, in the case that obviously not widespread outbreak, but that more of these clusters might pop up, that we are prepared to deal with it then in those situations.
Absolutely, and that the people on the ground are confident, that they know what to do, and that they've practiced before they're in a high-stress situation, taking all the actions they need to do to care for patients safely.
Turning now to Africa, which is of course where the hotbed of all of this, thousands of cases of people dying and also thousands of actual cases of the Ebola itself. Mm-hmm. Are these countries prepared to deal with this as it goes forward? We see projections of thousands upon thousands more being diagnosed with this in the coming months.
So the 3 most affected countries, Liberia, Sierra Leone, and Guinea, are in no way capable of dealing with a catastrophe of these proportions. And in fact, they've been overwhelmed.
And is that an infrastructural issue? Is that an economic issue? Is it kind of a combination of all of those factors?
Liberia and Sierra Leone are countries that just came out of prolonged conflicts, and their economies were just beginning to recover. They had very few clinicians to start with. So in all 3 of these countries, they are low to low middle income. They didn't have an enormous amount of healthcare infrastructure to begin with, and they had very few healthcare workers. And unfortunately, the Ebola virus disease outbreak has taken an enormous toll on the healthcare staff they did have.
One final question about the vaccine. So far, there is not one that is proven to work necessarily. Is there any chance of us seeing one in the coming months?
There were several vaccines that were in very early stages of development, not even in clinical trials. So obviously now there's a lot of pressure to get those into clinical trials, and that's happening, but it's happening relatively slowly. And none of the companies or the research organizations that were working on them have the ability to scale up quickly. So I think we're going to have to trust that we can address this outbreak through what we know works: human power, contact tracing, isolating people that we know have been exposed to the disease and trying to prevent them from transmitting the disease to others, and doing the best we can to care for the people who have been infected, and not depending on the arrival of a vaccine in time to interrupt transmission.
Because ultimately there are so many cases, and exponentially they might double and increase beyond that coming in the next couple months.
It's very possible, yes.
All right. Well, thank you so much, Dr. Fischer, for all of your insights, and thank you for joining us on Crossfire.
I'm delighted to be here. Thank you.